Right, hi Stuart, and welcome to my channel, which concentrates on therapeutic and technological interventions. I'm really excited today that you're going to tell us about video interaction guidance, known as VIG for short. And if it's okay, I'm going to ask you a few questions to give our viewers an idea of the therapies. Is that okay?
Yes, that's fine.
Great, thanks. Question number one then is, can you tell me a bit about your background and your experience as an educational psychologist?
Okay, well, I've been a specialist educational psychologist as long as I can remember, and that's a long time. And I've worked in lots of different local authorities across Wales and the UK during my career. As part of my EP work, I've always dedicated time to providing therapeutic support for schools and families when children have emotional and behavioural difficulties. I trained in and used a wide range of therapies to help make a difference for children, families and teachers. And I've worked with the following ones, including family therapy, behaviour therapy, solution-focused brief therapy, social skills and counselling groups, EMDR, which is eye movement desensitization and reprocessing, that helps people to heal from the symptoms and emotional distress arising from disturbing life experiences and PTSD, and VIG, which we're going to talk about today, which is video and interaction guidance, which helps parents, teachers, teaching assistants and children improve their reactions, relationships and attachments. I retired from local authority work a year ago, and I'm now working part-time independently, providing VIG and EMDR online.
Oh, great, that's a lot. How did you get involved in VIG then?
Well, as well as my therapy work, I've always been a bit of a geek and interested in IT, and started writing educational programs for children and teachers in the very early days. I expect many of your viewers will not have had the pleasure of trying to load a program from a cassette recorder with the horrible beeping noise or a dial-up connection. So fortunately, things have moved on. It's now possible to analyze videos of social interactions in great detail and help people to notice how they're interacting. They can then identify and fine-tune these skills that best help them connect or attune with each other. Excuse me. I decided to train in VIG so I could combine my IT and therapeutic skills to put them to best use.
Great. So what is VIG then, and how can it help children and parents?
Okay, well, I'll start by saying that when you first meet with your VIG practitioner, you will discuss the issues you're experiencing and then agree some goals for change. This is often the first step in moving towards a better future with you and your child. And the VIG practitioner will arrange to meet with you and your child to say a short video, about 10 minutes, or you could take this yourself using a laptop or tablet and send a copy to the practitioner. This may be taken in your own location or whether you feel most relaxed. And if possible, this should be an activity that both you and your child really enjoy. VIG looks at building on strengths. So we want clips that show when you're getting along. Your VIG practitioner will then look at the films and use the principle of what is called attunement, which I'll come to later, to pick out some successful moments to show to you the next time you meet. You will then look together at the still pictures and videos of these edited moments and talk about what you think is happening. I use a shared, here's the word attunement again, we will be explaining it shortly, chart during this process, which helps a parent, teacher or teaching assistant and myself to notice the ways in which the adult and child react to each other. This is very much a shared activity as both the adult and VIG practitioner work together using their own knowledge and experiences. Excuse me. In terms of the number of meetings, this depends. Most families and schools find that 3 of these films and discussions, which were called shared reviews, are enough to make progress toward their goals, but this will be discussed with your VIG practitioner during the sessions. Okay, how's that?
Yeah, great. So what technology do you use to provide VIG online?
Well, I use Zoom like this for my VIG meetings. It's very flexible and easy for myself and clients to use. It also allows me to take video clips with permission, of course, of the adult and child interactions, and also look and analyze together them with the stills and clips of the successful moments in the interactions. As I mentioned earlier, I've also developed an online attunement chart, which the which the client and I can both use together, online or on paper, to help with the analysis. Through some of the things that we're looking for, which are on the chart, the key things that we're trying to focus in on, which are things like being attentive to the child, turning towards them, showing friendly posture, looking interested when you're talking to the child, giving them time. Time and space are really important in VIG work, because you need to give people time to answer and to respond and to think. Giving them space and wondering about what they're doing. Just sometimes taking the moment to have a look and think, well, that's great, I wonder what they're thinking about. And enjoying watching, just sitting there and watching and enjoying. They were also looking at being encouraging, being warm and friendly. Again, waiting for the child to respond. Being playful, listening and naming what you see. We're also looking at how you receive what your child is saying by things like head nods, eye contact, using friendly words, repeating what the child has said, showing you've noticed and smiling. We're also looking at your attunement. Are you cooperating? Having equal turn taking, which is really important. Having fun, that's probably the most important bit of the lot. That's the most important thing, is that you and your child are enjoying the activity and each other. Taking short turns and also checking for understanding, repeating back to the child so that you can show that you've understood what they're saying. And that the really high order skills are in the area of guiding and supporting, making suggestions, providing help, offering choices and giving information, whilst always trying to follow the lead of the child in these interactions. Okay, so that's a summary of those are the things that we're really looking for in the clips. And it's fascinating to do, because I've been trained in VIG and I'm an experienced psychologist, but I don't know the child as well as the parent does. And what I always find in there is I will spot things they won't notice, the parent won't notice, and they'll spot things I haven't noticed. And sometimes you can have really detailed discussions about a very fine interaction, and you can do it in slow-mo and just look at where the child's looking, the posture. And it's a fascinating, and it allows the parent to see the intricacies of the interaction and what they're doing that helps contact the child and cooperate and attune to them. So that's how it works.
Great. Can you share with us then an example or a case where you've used VIG?
Okay, obviously I can't show any video clips or give it any personal details for confidentiality reasons, but I'll give you some overviews of VIG cases and what clients have said after completing the sessions, because I always use a feedback sheet. So the first one of my first cases was a junior age pupil with a long history of emotional and behavioural problems at home and school. And we had 3 sessions with the parent, and this is what she said at the end of it. We enjoyed the VIG activities and the feedback sessions were essential so that I can understand. Also very interesting. I now make eye contact more often. I'm not contradicting myself so much with my verbal and body language. I'm giving time to respond. It was very enjoyable service for both my child, myself, and useful, and made a noticeable difference to the child's behaviour at home and at school.
Great.
So that was at a junior age. This is a preschool child that I worked with more recently, which the parents felt that the child had a lot of anger and temper tantrums and was lashing out at the parent. So we had 3 cycles of intervention there. And this is what the parents said at the end. What's changed? Understanding each other, picking out the things we hadn't noticed. It's nice to see my child not being bossy and taking turns. Having more fun with my child. The fun comes up all the time and it's so important. Giving each other space and time. When you use the principles of attunement, things work better. And here's another example. This was a primary school pupil whose parent felt she was depressed and lacking in confidence and struggling with some of her work. So this was the feedback from their parent, who just had 2 cycles of VIG. I attended a number of VIG sessions, whilst initially a little skeptical about VIG. Once we completed the first session, the benefit of this technique came clear to me. It's easy to work with and the results have been wonderful. Great. So that's just some of the examples.
Yeah, that's wonderful. So where can someone find out more about VIG and how can they access it?
Okay, there'll be some actual links somewhere in the video that you can use, but I'm going to tell you about the sites. The best place to find out more about VIG and how it works is at the VIG UK site. This site includes some videos which show the process in detail. So it's really interesting to look at how I'm just giving a brief explanation, and this takes you in great detail. Now, most VIG work is carried out in the public sector or by charities, in health service or some educational services. And if you're looking for such a provider of VIG, you should contact your local authority or health service advisor. What's provided does vary quite considerably from authority to authority. But this site also has a directory of independent practitioners like myself, whose training has been accredited by VIG UK and that offer services directly to families and schools. So there is a directory on there of a number of independent practitioners, including me, that you can access. So there will be a link up later in the video, pardon, just to show you exactly how to get there.
Great, great. Well, thanks for joining us today, Stuart. I hope the information given today has been of interest to all of those who are watching. If you feel you can benefit from accessing the therapy, Stuart has given you the information you need. And please feel free to contact the VIG therapist that he's recommended and follow the links that will be provided underneath this video. Thanks very much, everybody, for watching.
Thank you, Anne. Thank you, Ange, for giving me the opportunity. Cheers.
Cheers.